I'm currently a Consultation-Liaison Psychiatry Fellow at the University of Chicago. It was during my third year of psychiatry residency that I made the decision to do CL training. Some of the factors that influenced my decision was that I was always interested in health disparities, and I found that patients with psychiatric illness who had medical problems were the most likely to get poorer outcomes. And I felt like consult liaison psychiatry allowed me to kind of be that bridge between psychiatry and medicine and allowed me to stay up on my medical knowledge and make sure that my patients were getting adequate care. One of the things I think that really affects residents' decisions not to do CL is one, the hours can be long. And then often I think people are thinking about their salary after years and years of debt from medical school and don't always feel that a consult liaison fellowship will really have an impact in terms of their salary differences. One of the things I think is the benefit of doing a consult liaison fellowship in terms of my career, I would say, is definitely the ability to work in different settings. So I feel very comfortable working in an academic setting going forward with very complicated, medically complicated patients, as well as if I wanted to, I could also work out in the outpatient setting and do collaborative care and run that type of clinic. Or work in women's mental health or psycho-oncology. I think just in terms of the opportunities after doing CL, you just feel much more comfortable handling any type of patient. I think one of the big challenges is one, that the hours can be long, and I think that is something that people should take into consideration. And one of the other big challenges is that I think you really need to be comfortable working within this kind of gap between medicine and psychiatry that we find, and being able to deal with, people not always understanding our patients with psychiatric issues and understanding like why we're recommending the things that we're recommending. I think that's one of the biggest challenges. I think it's really important to be able to build relationships with the medical and surgical teams. I think you need to be comfortable managing conflicts between the medical team and the psychiatric team. And I think you also need to have sufficient medical knowledge to know when your patient needs to have a different approach. We often have ways how we manage patients that we learn in psychiatry that don't always work for our medically complicated patients. So I think those three things is what makes a good CL psychiatrist. I would say, it's really important to work on your leadership skills and be prepared to be able to lead a team. And with that comes with that piece of managing conflict. And I think people think about CL in terms of the medical knowledge that you have to have, and I think that's important. But if the teams don't listen to you because you don't really know how to build a relationship with them, I mean, that's the biggest issue. It's like you can know everything, but if you don't have those relationships, it's hard to really make a difference. Yeah. I think it's hard to get enough CL experience just in the kind of 2 months that you're required in psychiatry residency. I feel like for myself, I chose to do a CL like chiefship year, and I think that made like kind of like solidified things for me in terms of like my understanding of what I could do, mostly in the outpatient basis and collaborative care. But I think without this particular year, I don't think I would feel as comfortable with managing medically ill patients who also have like neuropsychiatric issues.
My current role is that I'm one of the consult psychiatrists here at the University of Chicago Medicine. I'm also the Director of Medical Student Education in Psychiatry for the Pritzker School of Medicine, and I am the Faculty Associate Director of Admissions for the Pritzker School of Medicine. I decided to enter into consultation psychiatry when I was a resident, probably during my second or third year. I had a really strong consult rotation as a resident, And prior to entering psychiatric residency, I had a strong interest in internal medicine as well. And I found that the consult rotation allowed me to combine those interests in ways that other parts of psychiatry did not. I think my fellow residents were discouraged from CL because of the unpredictability of the hours as much as anything. I also think that they didn't necessarily enjoy their rotation as much as I did because of the more intense nature of the work. I think that consult psychiatry has had some real benefits. One of the primary ones is that as a medical educator, it's allowed me to relate to the students and to the rest of the medical school in a more authentic way. When I meet with my fellow educators, I often share patients with them and we discuss patient problems together. And I think it's helped them to see me as a peer. I also believe that consult psychiatry provides advanced training in general psychiatry and has allowed me to be a more excellent psychiatrist. I think one of the challenges in consult psychiatry is that the patients are never just your own. And making collaborative decisions about complex patients is an ongoing challenge. I also think that the unpredictability of the work does at times make it difficult for me to serve in my role as educator. Three things that make a good consult psychiatrist. I think first would be flexibility and the ability to adapt to new situations. I think second would be real compassion and having interest in improving the lives of patients in difficult situations. And I think third, an ongoing interest in educating the next generation, because consult psychiatry has an important place in academic medical centers. I think if someone's considering a career in consult psychiatry, that they should absolutely move forward with it. I think that they will find that at the end they will be the best psychiatrist that they can be, that they'll have a very broad set of skills that would allow them to work in virtually any psychiatric setting, including inpatient, including any sort of outpatient setting. I also think that the opportunities for academic collaboration are strong, and that as much as any fellowship, it will set them up for an academic career. I would recommend to a resident to do a consult fellowship if they have any interest in either being an educator or improving their psychiatric skills.
So I'm currently the director of our inpatient psychiatry service, and I'm the assistant program director for the adult residency program. So during my second year was when at my program, we did our CL rotation, and I really enjoyed the collaborative aspects of it, being able to work with our colleagues in other specialties. I liked the teamwork aspect of it, and I liked just the pace. I felt like it was a bit faster, and I enjoyed just being able to walk around as a team and being able to see a variety of different patients with different pathologies. I feel like it's probably related to many of them weren't as interested in pursuing a career in academic psychiatry. Some were dissuaded by the extra year. They wanted to just kind of get out there and start working. Benefits I've seen are having a presence within the institution, being able to have more of a leadership role, and providing more education for medical students, residents. So as a CL fellow, I was thrown into this leadership position, which I never really experienced before. And I realized it was difficult, and it was really helpful to be able to go through that while still having mentorship. And then I also realized that I actually enjoyed it. And enjoyed working with residents and working with medical students and being able to teach them in various situations in a variety of different ways. It helps feel like a lot of our colleagues don't see psychiatry as much and we don't get to interact with each other as much. So it's helpful for us to see what the others do and being able to work together to help our patients, work together to be able to provide good education for our medical students and residents. So it would be patience, flexibility, and being able to appropriately and effectively communicate, what our thoughts are, what our diagnoses, and about the reasonings behind our recommendations with our patients as well as the primary team. I would recommend somebody to do a fellowship, especially if you're interested in pursuing a career in academics. So really thinking about what you'd like to see for yourself in the future, like to see what were the things that you enjoyed in residency or in medical school, and seeing if if that does lead you to aspects of academics, and that so I would encourage to pursue the fellowship. Yep.